People often ask whether acupuncture hurts, and often it doesn't hurt, but sometimes it can do. Now, I feel the reason why people ask this question is because their association with needles is the great big hypodermic needles that we see when we go to a GP surgery that's used for either injecting something into the body or drawing blood out of the body. Now, these needles are huge and they hurt and they look scary, so it's understandable why people are like, oh, does acupuncture hurt? Now, the needles that I use are 1/4 of a millimetre thick, so they're a little bit thicker than a hair. And the other difference is that what I'm trying to do is I'm trying to needle in between the space between the muscles. So the channels of acupuncture follow the fascial planes between the muscles. And so when I'm locating a point, I'm looking for a gap or an indentation. And so I'm actually needling into nothing. So most of the time it doesn't hurt. Now, when the needle's inserted, there can be like a very brief pricking sensation. And that's just because the needle's going through the epidermis, which is where most of the nerve endings are. Now, once the needle's in, there can be a mild dull aching sensation, which therapeutically is a good thing. But if ever that sensation is too strong, you just need to let me know and I can adjust the needle and it will reduce that sensation or even make it go away. The main thing is that you're comfortable through the treatment.